Hello and welcome back to another one of our special news episodes here on Taking Control of Cancer. I'm Steve Bland and I'm joined as always by the Managing Director of the North East London Cancer Alliance, Femi Odewale. Hey Femi, how you doing?
I'm good. Hello, everyone.
And are you enjoying the sunshine that we're having, and we're even having it in the north of England where I'm sitting right now?
I was going to say it was you that I thought it was you that brought it from the north right through to the south as well.
We were just chatting before we started recording, Femi, but it's a really busy time for you guys, isn't it? As we look to the start of the new, what the new year is at the start of April, and you were just saying about all the things, all the exciting things, which we're gonna, cover plenty of in the podcast,
Absolutely.
post April, but all the exciting things that you've been planning that you're gonna actually have to do and make
Yeah,
happen now.
yeah. The things that we're planning, we have to do, and some of the things that are detailed in the actual plan as well. So the strategic plan as well, in terms of our local interpretation of that. So it's going to be an exciting, lots of paperwork, but really there's going to be lots of exciting things to come in the new financial year. Financial year is starting from April onwards. That's when we receive our new funding to then kick off new projects or continue some of the old projects, really.
Exciting times. The first thing we're going to talk about, Femi, we are recording this on the 20th of March. It's a Friday, but on Monday just gone, it was National Cancer Clinical Nurse Specialist Day, National CNS Day. And the CNS is something that we've talked about a lot of times on this podcast. We've actually got two episodes that we put out on Monday. One talking about a new pilot project all about CDLs, and the other one, I spoke to three really amazing international nurses who work across the alliance, who are from the Philippines, and told me all about their experience of working in hospitals in the UK, and how they got here. It was just a really fascinating chat, but it shone a bit of a light on just how important CNSs are in everything that we're doing here.
Absolutely, they are our heroes. I mean, I think that's the only way to describe them. And I know through the podcast that you've done in the past, you can clearly see that. And I think it's so important to continue to shine the light on the work that these guys are doing. They're saving lives. They are there for our patients. They're getting patients through the most. So yeah, I mean, as well as other nurses as well. I mean, CNS is for us because we're talking about cancer. CNSs are absolutely very special to us and they are our heroes. So yes, let's continue to shed more light there. So I'm really glad that we had the National Cancer Clinical Nurse Specialist Day. I think it's something that we should continue to do. I think it's been running for 5 years now, hasn't
Yeah,
it?
it's been running a little while. I think it actually originated up here in Manchester. I think it was a GM Cancer Alliance initiative initially, and it's just grown and grown and grown, and it's brilliant because the CNS is a lot of a CNS's work is a little bit of the unseen stuff
Yeah.
that makes the experience of a cancer diagnosis for a patient and their family just that much easier.
Mm.
And some of it's the stuff that isn't sexy, or it doesn't get a lot of attention and stuff, but it's the stuff that really makes a difference. So yeah, really, really, really pleased that we're shining a light on it. Actually, there's some videos that we'll put a link to in the show notes. Some videos of some CNSs talking about their role and encouraging people to come forward to work as a CNS. So it's a fantastic area to work in, and yeah, very, very, very rewarding. The second one, Femi, and this is actually an area that I really want to do a podcast on, and we've talked about it a lot. The North East London Cancer Alliance has recently completed a piece of work in partnership with Friends, Families and Travellers and the Roma Support Group to address persistent inequalities in cancer prevention screening and early diagnosis experienced by Gypsy, Roma and traveller communities. It's a really interesting piece of work, this, Femi, is it? And I think probably not. If you were looking at areas or parts of our community where they might experience inequalities, you might not think of this straight away, but it's, as this piece of work is showing, it's definitely an area that needs looking at.
Yeah, vital piece of work, vital project, shall I say, vital piece of work. And we in North East London, we do have a large population of Gypsy, Roma, and traveller communities, and this is a particularly important project alongside some of our other grassroots projects that we have in place. I mean, again, you can see the impact of the project so far. So, again, we've seen confidence talking about cancer screening rose from 58% before the training provided as part of this project to 92%, while confidence in supporting others to navigate screening pathways increased from 50% to 92%. And again, you start to take a look at things like the knowledge of screening eligibility also improved. So again, prior training was only around 50% of champions correctly identified eligibility for cervical screening, 25% for breast screening, and none for bowel screening. After the training that we provided as part of this project, 92% currently identified eligibility for both breast and cervical screening, and 73% for bowel. So it is really an important area, it was an important project, because it's seeing a yield which ultimately should help to increase and improve our earlier diagnosis through awareness. So it's a really important project, and we're doing projects like this across, all of the different kind of areas, and it's part of our grassroots series of projects. So really important, and we're expecting and hoping that this will really shift the dial for earlier detection in cancer for our population in North East
Yeah.
London.
It's that important. We did a podcast a couple of weeks ago talking or looking ahead to the inequalities strategy that's coming at the end of April, along with the workforce strategy, the AI strategy.
Mm.
Lots of exciting work, but the inequalities one, especially for this part of the world, this part of London, where we've talked over and over and over and over and over about, just how diverse the population is. So the inequality strategy for you guys, I imagine, is right at the heart of everything you're doing.
Oh, 100%. Especially, and I've said it 1,000 times and I keep on saying it, we in North East London have a really diverse population, which makes engagement not a one size fits all type of approach that we have to take to it. So yeah, this is just important alongside all of the other kind of
Yeah,
related.
yeah,
You
for
was
sure.
Yeah.
The next piece I want to speak about, Femi, is one that I won't pretend to know an awful lot about. A piece in the Guardian saying that cutting air pollution should form part of the government's strategy to reduce cancer rates. That's according to the European Code Against Cancer. Now, I don't imagine that either of us are air pollution experts. Suffice to say that it doesn't take a big leap to imagine that the quality of the air does obviously impact your lungs. But this is another um, example or another way of encouraging change that ultimately prevents cancer at an early stage, rather than that's a big part of obviously the National Cancer Plan, a big part of the work that the Alliance is doing about prevention at an early stage.
Yeah, like you, Steve. I was. This is really an interesting area. Not an area that we've done too much on. And again, something that's kind of it's huge. It's a country's effort, and you can see as part of that, he starts to talk about some of the studies and some of the work done at the University Utrecht University in the Netherlands. Again, they've been doing a lot of work in this particular area, and they're categorically calling out that actually policymakers should aim to meet the World Health Organization global air quality guidelines for outdoor air pollution. So it's wider than us. But if we take a look at kind of, my view and now our view on that, there's, prevention is key, and it's part of the work that we're currently doing. And you can see some of the work that we're doing around lung cancer screening. And again, we know that smoking contributes to air pollution. But again, I mean, I guess those are some of the areas that we're kind of working on. But it's an area that's interesting, actually. And until pointed out through this article, I think it's something that it's worth us bringing something back here at a later stage around this particular aspect. Will be interesting to find out a lot more about it as well.
Yeah, there's some really interesting stats in this piece actually in the Guardian. Apparently, 28,000 cases a year of lung cancer can be attributed to particle pollution. It's
Mm,
estimated that lung cancer deaths will be reduced by more than 10% by meeting WHO guidelines for air pollution. It's
for quite a bit.
probably a little bit beyond, solving air pollution is maybe beyond your powers, Femi. You're a powerful man, but that might be beyond you're beyond it. But lung cancer awareness more broadly around smoking, some of the keeping fit, the active programs you guys have got, the community games initiative.
Mm,
There's loads of stuff that can really promote our lung health and our general health. And I think that's the message to prevent lung cancer. Things that we can do ourselves rather than
yeah,
if there's work that the government should be doing, fantastic. We hope that they see things like this and take action. But there's things that we can all do to, as we say in this podcast, the very essence of it, taking control of cancer, things that we can all do to give ourselves the best chance.
yeah.
Now, this is a good one because we did a podcast from Maggie's Centre, didn't we, at St. Bart's?
Hmm?
It'd be last year, probably sometime.
Was it
Um,
the year before? I can't even remember, but it's been quite.
it was a little while ago now, wasn't it? But it's, you know, a wonderful, wonderful place. And there is a V&A Dundee. I didn't even know there was a V&A Dundee.
There was a die.
Uh, uh, an exhibition at the V&A Dundee celebrating 30 years of Maggie Centres. Now, Maggie Centres, yeah, as everyone knows, have been providing not just not just kind of one thing. They provide just complete holistic care for
They do.
um, the person going through cancer, but also their families. They're wonderful places. If you haven't been to one and you are affected by cancer, do go and give one a go. Pop in and see if they can help because they've got so many wonderful services, um, on offer for cancer patients, including support, advice, networking with peers, nutrition advice, psychological support, um, a whole range of information for anybody going through a cancer diagnosis. They're wonderful places, aren't they, Femi?
They really are indeed, and such beautiful spaces. They've designed it so modern, and what was the thing that we said as soon as both of us walked in there, we were just like, you just feel so at peace there, which is such an important part of the psychological aspect of hospital care as well for patients who are going through cancer. I mean, we were wowed. Listen to the podcast, you can hear how wowed we were, or I was certainly, because I think I was ashamed that that was the first time I'd been there. So yeah, really, really, really great work. So I can see how there is an exhibition there. It's an art, it's a really kind of thought through, art driven type of space.
Yeah, yeah, loved it. So if you're in Dundee or if you are minded to go to Dundee, that's there. Do go and take a look. The last one this month, Femi. This is actually a piece of work um, in the States. 6 cancer types are apparently rising faster in younger adults than in those who are older in at least 5 countries. That's according to a new study of global cancer incidence. Um, it- there are big kind of wide-ranging studies all the time. I think the thing that really stood out for me on this is that it's more evidence that sometimes, or a lot of the time, the people that we think get cancer, the stereotypes, the people that we imagine get certain types of cancer are not the people getting cancer. The stereotypes are changing. Factors in the world. Um, we talked about air pollution, things like that are changing who's getting cancer. And a lot of the work that we do, not just on this podcast, but in loads of different works, is changing perceptions, addressing taboos, addressing misconceptions, and you're making people aware that literally anybody can get cancer. And I think this is another another example of that.
It certainly is, and I mean, we mentioned it earlier. There's so many different factors, lifestyle, impacts, and so many different things that are obviously contributing to this. But you're right. I've said it on the podcast before. I thought cancer before I went into kind of working in cancer areas. I thought it was an old person's disease, but it's you're seeing the cases changing continuously. I mean, again, it's an area that we've really started to shed a lot of light on with the work that we're doing with HPV. Again, it's detailed in the National Cancer Plan, which was launched in February. Again, if people went to our podcast, they would have heard some of those areas kind of being called out. But again, we are mapping out, a number of activities to support this as a priority over the coming months and years. Again, we spoke at the beginning of this podcast. We've got some real exciting pieces of work coming out of projects. This area is an area that we're going to really be focusing and partnering on as well. And again, our delivery plan will be made available on our website. Our delivery plan for 26, 27 will be made available on our websites shortly once it's signed off. But again, we're also doing awareness campaigns, which I'm hoping everybody that listens to this would have probably seen, where it's raising awareness to support younger people. So, for example, we work with Copperfield right now, which is a charity which encourages young women to check their breasts and signs of breast cancer. And there's various other areas that we've got planned for our 26, 27 kind of areas of projects. So yeah, let's watch out for that. But it's a really important one because actually, if we can start to do some of those prevention now and raise some of the awareness now, people now know what to look out for, and people could also stop looking at it from the lens that perhaps I was looking at it before, which is, oh, it's an old person's disease.
Yeah,
They can
it's
start looking
absolutely
at it
not. Yeah,
actually and get it.
yeah, it's absolutely not. And these, as I said, 6 cancers rising faster in younger adults than older adults, and they are colorectal, cervical, pancreatic, prostate, kidney, and multiple myeloma. Colorectal's perhaps the one, personally that I've kind of seen. Dame Deborah James I've talked about it a million times, but Deb was a great, example. She was I think the perception in a lot of people would be that bowel cancer is, middle-aged men who drink too much red wine and eat too much red meat and that kind of thing. She was in her 30s, vegetarian, female, ticked none of the boxes, and yet she got stage 4 bowel cancer, and I think we could point to a million examples like that, and I think all of these stereotypes are preventing people from going to their screening appointments because they think it's not going to happen to them, and it's just not the case. And I think going back to screening, there are screening programs available for some of these cancers that are increasing and rising faster in young adults, and we need to keep hammering the message that if you qualify for one, take the chance to go. And although that said, most of the screening programs are for the older age group, aren't they? So I guess it's just about being aware of your body and aware of any changes. Go back to the back to the original messaging of knowing your body.
Yeah, no, absolutely.
Well, Femi, I reckon that will just about do it for March. We're going to have a load of stuff to talk about when we reconvene in April, and we've got loads of great podcasts coming up. I know we've mentioned it before, but really exciting year ahead, isn't it, Femi, with the National Cancer Plan and everything you guys have got lined up. So I will let you go and enjoy the Friday afternoon sunshine.
Brilliant.
If you're listening and you want to share this podcast, I'd love it if you shared it with someone that you know. If you think there's loads of previous episodes about all kinds of different topics, and if you'll find one. If you're affected by cancer anyway, you'll find one there for you, and you go and share it with somebody that you know, and it might just make a difference, might just help. Until next time, Femi, I'll see you in April.
Cheers. Thank you.